local participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, the preparations for our brand new OBGYN conference of 2019 are in full swing. And today I have a special guest with me. Here with me is one of the speakers for the conference, Dr. David Abel. Welcome, Dr. Abel.
Thank you so much, Kristen. It's a pleasure to be here.
Oh, it's wonderful to have you here, and we are so excited about this brand new conference here at Gold. And we will talk about your presentation in just a minute. You will be presenting on maternal cardiac disease made simple. Can't wait for that. But before we get into that, can you tell our listeners a little bit about yourself? Where are you located? And tell us a little about your background too.
Sure, I appreciate that. Well, I am a high-risk obstetrician. I started my career as a general obstetrician in a rural area in Vermont, in the northeastern part of the United States, doing water births and not having much support. And then I kind of changed gears because I was looking to get into academics and to become really focused in one field. So I went back for a fellowship in maternal fetal medicine, which is also known as high-risk obstetrics, at Duke University. And from there, I became very interested in various topics, including ultrasound, maternal mortality, and medical conditions during pregnancy. I was in private practice in Portland, Oregon for many years, but made the shift to serve underserved populations in the United States. Prior to my current work, I was the perinatologist for the entire Native American population of Alaska, which was very challenging and really rewarding to help a very needy population. Currently, I work in the San Joaquin Valley of California, again very rewarding, where there exist many health disparities, including an increased risk of maternal mortality for a pregnant woman that lives in that area compared to other areas of California. But it's nice to be able to fulfill such a need in that area of California.
Dr. Abel, you have such a wonderful background as a midwife. Hearing you speak about water birth in Vermont, that my heart is, I'm just like so happy to hear that. And then serving all these populations out there, first in Alaska and now where you are now, it's just absolutely wonderful. If you may, and I know you're an academic too and you're teaching as well, but walk us through a little bit about of your day in your practice.
Sure. Well, a lot of my day involves seeing folks in a small area in the San Joaquin Valley where I work at a federally qualified health center. And it's a model that really doesn't exist very much, where you actually have a subspecialist like this that goes to that type of clinic. But what's really good about that is that many of the patients do not have transportation to be able to see me in the bigger city, which would be Fresno, 60 miles away. So the fact that I can see patients there is really great. What's also great about this place, Kristen, is that many patients do not even have a car, but we
Right.
have a van that actually drives out to pick up the patients to bring them to me. So again, this is a really
Yeah.
nice model for patients that don't have the access, which is one of the problems for patients in general in the San Joaquin Valley. My day will consist of both performing consultation and ultrasound. In a given day, I'll usually see 28 to 30 patients, sometimes a little less. Perform ultrasounds as well. Most of these are detailed high-level ultrasounds where we are diagnosing various birth defects, and then I'm doing the counseling. I also do all my own genetic counseling during pregnancy, and I'm also being what is referred to me is various medical conditions during pregnancy. Some of the conditions that I focus on in particular are conditions that are very prevalent in the Latino population. So you can imagine sometimes my day consists of seeing a lot of patients with diabetes and chronic hypertension in pregnancy. I'd like to add that I also see folks who are not pregnant but who have medical conditions, whereas seeing someone like me is important to help plan a pregnancy. So I've been
Absolutely.
referred those patients as well.
Oh, wonderful. That's wonderful to hear about your work. And I love the setup of the center, how you describe it, that transportation indeed is a big factor in,
Mm,
you know, ability to get to be seen by specialists, and that is definitely a big plus. And that you are able to do all your own genetic counseling and your ultrasounds there, that's absolutely fantastic as well.
yeah, thank you.
And you're also in education, you're also teaching as well. Is that correct?
Yes, I would say teaching is a big part of what I do, and it's something I value highly. I work at both the University of California, San Francisco Fresno campus, where we have 16 OBGYN residents and medical students as well, and I'm
Mhm.
teaching them regularly. I also go to the main campus at University of California, San Francisco, where I teach their residents as well. There are 9 per year, which is 36 residents, but I also teach the fellows. There is a maternal fetal medicine fellowship there, and what I usually spend my time teaching those fellows is ultrasound, and in particular,
Mhm.
ultrasound of the fetal brain, which is another interest of mine too. So I get to be involved in teaching medical students, obstetrics and gynecology residents, family practice residents, as well as teaching maternal fetal medicine fellows. And I give lectures throughout the year in various venues as well on various topics, including the one that we're about to talk about today.
Absolutely. Let's talk about the topic then. Maternal, I love the title, by the way, Maternal Cardiac Disease Made Simple. It sounds to me like you're breaking it down for us. It's cardiac disease is not a simple topic. It's a very complex topic, right? So, but you're calling it maternal cardiac disease made simple. Tell us about this. I'm really intrigued.
Well, one thing that's very important to understand is that maternal cardiac disease, in other words, cardiac disease during pregnancy, is a topic that has received a great deal of attention of late, including a recent practice bulletin that was released in May of 2019 by the American College of Obstetricians and Gynecologists. This is a topic that we all need to know about. And when I say we, it doesn't have to be people that take care of people who are pregnant.
Mhm.
It could be those that take care of women of reproductive age who want to be pregnant. So this topic applies to all those types of providers. Number two, as you'll hear me talk about, maternal mortality has been a big focus in the last year or two, and there's been a lot written about it. But what has been very interesting to note is that number one, of all the developed countries in the United States, maternal mortality is highest in the United States of all the developed countries, which is a
Mm.
very surprising fact for a lot of people. Secondly, the number one etiology of this maternal mortality in the United States is not hemorrhage or hypertensive disorders or thromboembolic disease like it is in developing countries. It is indeed maternal cardiac disease. The reason I entitled it Made Simple is that many people, I think, get very afraid, Kristen, when
Right,
they hear about cardiac disease. It's like, oh, I really can't understand that, or I have to refer out. So
right.
I think one of my goals is through this talk, people could have a little less anxiety and say, you know what? I can do some of this. I may not be able
Right.
to do all of it, but I don't have to feel afraid to face this kind of thing should I encounter that in my practice.
How wonderful. I'm looking forward to learning more because, yeah, you're absolutely right. Many of us think, oh my goodness, this is not my area of expertise. This is too complex. I need to, refer out. I don't even want to get
Exactly.
involved with this here because scope of practice and so on, So definitely the more, but even if we decide to refer out because, simply we have to, but understanding more will help us all too, right? I mean,
Exactly.
absolutely. That's I'm very much looking forward to your presentation. Now tell me one thing. You mentioned the statistics about cardiac disease and the United States compared to other developing countries is on the top there,
Sure.
statistically speaking. How is that? I know this is a you could probably talk for hours about this, but just briefly, where is this coming from?
Sure. Well, let me just illustrate the point a little bit with a few numbers very, very briefly.
Yeah.
Take a developed country like Sweden or Finland.
Hmm.
The risk of a woman dying in childbirth or 6 weeks after, which is how we define maternal mortality, is about 1 in 10,000. Now, the maternal mortality rate in the United States is about 1 in 3,800, which is still relatively low, but you can see much
Mhm.
higher
Right.
than a country like Finland. So then the question is why? And I still think that is a question without a definite answer. But I do think that we've uncovered some of the reasons why maternal mortality is increasing in the United States when it is decreasing for every other developed country in the world.
Mhm.
One is health disparities, and this
Right.
has to do with race,
Mhm.
poverty, access to care, lack of health insurance. Also, if you live in a rural area, so now we're even talking about geography. If you live in a rural area, you may have you may have a problem with access as well. So all of those combined are contributing to the increased maternal mortality in the United
Mhm.
States.
Yeah. That makes sense, absolutely. And that means we need more physicians like you, Dr. Abel, and more clinics that provide for the
Definitely.
population. Absolutely. Dr. Abel, it's been such a pleasure talking with you. And before I let you go, I know you have some interesting hobbies I've read in your bio, so I have to bring those up. I just love
Oh
reading this.
no.
You
Okay.
you love making jam, collecting rock music criticism books, and hiking in the desert. How fantastic is that? I just have to share that with our listeners here.
You can call me Dr. Jan Kristen if you'd
Oh,
like.
Dr. Jam. Oh, how wonderful. Well, thank you so much. This was a delightful talk here, and thank you for. I know how busy you are, and it means a lot to us that you spend some time here with us today talking about your background, your work you're doing out there in the field, and the presentation that we have here at Gold.
It is my pleasure, Kristen. Thank you so much.
Thank you. And for our listeners, the presentation Maternal Cardiac Disease Made Simple is part of the Gold OBGYN Conference of 2019. And the conference will start November 4th. This presentation here will be available as well. And we are looking forward to seeing you there. For more information on the presentations, please visit goldobgyn.com. And we do have two open access keynote presentations available that you can sign up for free as well. So we hope to see you at the conference, at the Gold OBGYN Conference of 2019. Thank you everyone for listening. Bye bye for now.